Today we'll take up the UPSC Combined Medical Service Examination 2024 surgery questions. Okay, so and actually I was going through the explanation made on YouTube. So I saw one of the senior faculty committed 3-4 mistakes. Okay. He has explained very nicely but committed mistakes. Why? Because he was not going through authentic reference. Okay. So the UPSC mainly take reference from Bailey. Okay. Bailey. So I have taken all the reference and all the question direct line from the Bailey and Love. Okay. You do not go into other books. You just focus on the Bailey and Love. Okay. So we'll take up the first question. Okay. Which of the followings are the risk factor of wound infection? Okay. So this question from this table. So risk factor of increase risk of wound infections are malnutrition, metabolic disease, immunosuppression, colonization and translocation of GI tract, poor perfusion, foreign body and poor surgical technique. Okay. So let's see what are the options. Malnutrition, yes, there is a malnutrition. Poor perfusion and foreign body material. Okay, this is foreign body. Okay, so antibody is not related. Okay, so there is immunosuppression, so it's a contrast. So the options are 1, 2 and 4. So B is the answer. Okay, now is the second question. Which type of cancer are associated with exposure of ionizing radiation? Okay, so this is also direct from the table, one of the table from the Bailey. Ionizing radiation is a risk factor for leukemia, breast cancer, lymphoma and thyroid cancer. Okay, so what they have given, they have given the leukemia, yes, breast cancer is yes, lymphoma is yes. So lymphoma and leukemia both are associated. Okay, so options are 1, 3 and 4, not the lung cancer. Okay, okay, next one, next is 3. Which of the following are correct regarding Lee-Fraumeni syndrome? Okay, so this is also direct table from the Bailey. Lee-Fraumeni syndrome. Okay, it has autosomal dominant. Yes, it is autosomal dominant, and inheritance is associated P53 gene. Yes, P53 is associated. Okay, this is wrong. Autosomal recessive and associated with increased risk of sarcoma and leukemia. Yes, there is an increased risk of sarcoma, leukemia, osteosarcoma, brain tumor, adenocortical carcinoma. Okay, remember cortical. So there is an increased risk of sarcoma and leukemia. Yes, and it is associated with increased risk of brain tumor and osteosarcoma. Okay, so 1, 3 and 4. Okay, so option B is correct one. Next is question number 4. A 48-year-old smoker present with OPD complaint of cramping pain in both calf and walking to about 100 to 150 meter. The pain is relieved on taking rest about 2 to 3 minutes, and patient is able to walk for some more distance again before the pain appears. The presentation is suggestive of, so you see the definition. Okay, so intermittent claudication. Okay, this is seen in chronic atrial stenosis. Okay, so it is result of anabolic muscle metabolism. Okay, so it is brought by walking and not present on taking the first step, unlike osteoarthritis. Okay, so this is ruled out. Okay, on relief by rest in both standing and sitting position, usually within 5 minutes. Okay, so 2 to 3 minutes he was getting relieved. Okay, unlike nerve compression from a lumbar intervertebral disc prolapse or osteoarthritis of the spine and spinal stenosis, which is typically relieved only when resulting in sitting position for longer than 5 minutes. Okay, so this all are ruled out. Okay, okay, so this is intermittent claudication. Okay, and few more important point. Most commonly group affected by claudication is calf and artery associated superficial femoral artery is most commonly associated, and Leydig syndrome, it is buttock claudication, okay, buttock, because of aortoiliac, okay. So aorta is affected, okay, main word is aorta, okay, and person present with impotence, okay. Okay, now come the very favorite topic of all surgical examination, like thyroglossal cyst, okay. So there is a midline neck swelling just below the hyoid bone and managed by cyst trunk operation. The hints are midline neck swelling and below the hyoid bone, cyst trunk operation was done, and patient was needed post-operative thyroxine, okay. So we'll take the few important points. So embryology is the thyroid gland descent early in fetal life from the base of the tongue toward the position of the lower neck, okay. Okay, so thyroglossal cyst present the persistence of the its track, okay. So it's found anywhere between in or adjacent to midline, so midline from the tongue base to thyroid isthmus, okay. So in rare case, what appears to be thyroglossal cyst in incompletely migrated thyroid gland, and that is the only functioning thyroid tissue in the body. That's why this patient need post-operative thyroxine replacement, okay. So we must do ultrasound neck before the surgery to confirm the cyst and presence of thyroid gland in the normal location, okay. Okay, and there is one very favorite question: the classical cyst move upward on swelling and tongue protrusion. This is keyword, tongue protrusion, okay. Okay, and the treatment is done, the whole thyroglossal tract is removed along with removal of the body of hyoid bone, okay. So this is thyroglossal fistula, okay. Okay, the name of the surgery is cyst trunk operation, 1000 time ask, okay. Next is question number 6. 40-year-old smoker present with soreness of the tongue since 2 months. On examination, it is found that oral hygiene is poor and there is a white plaque over the lateral border of the tongue. What is the next step in the management of this patient? So the risk factor of oral cavity malignancy are smoking. Others are alcohol, betel nut, HPV, hereditary condition, immunosuppression, chronic infection, and potentially pre-malignant lesion, okay. So this patient was a smoker, okay. So next hint they have given the poor hygiene, okay, and there is a white plaque, okay, white plaque on the lateral border of the tongue, okay. So majority of the oral cancer do not originate from the pre-malignant pre-existing condition, okay. So there is a few lesion like leukoplakia, erythroplakia, erythroleukoplakia, okay. This proliferative verrucous leukoplakia, okay, these all are predisposing condition or pre-malignant condition to oral cavity cancer, okay. So the highest one is speckled leukoplakia or erythroleukoplakia, okay. This is also MCQ, okay. So in all the condition, biopsy is the lesion is advocated for accurate pathological diagnosis. This was the question asked, okay. And for regarding the last option, surgical removal of the pre-malignant or dysplastic lesion do not completely remove the risk of transformation. So you have to do biopsy and then you take definitive treatment, not just topical curetization will do the need, okay. Okay, so now come the question number 7, okay. The consider the following the causes of visual loss, okay. Obstruction of the central retinal artery, vitreous and retinal hemorrhage, cataract, and retinal detachment. So there is a one paragraph in Bailey. They have given the painless loss of vision. It may be acute and chronic. In acute, there is a obstruction of central retinal artery, okay. You are getting in this option. Then vitreous and retinal hemorrhage, and then vitreous and retinal hemorrhage, retinal detachment, okay. And the cataract is the chronic causes of painless loss of vision, okay. So option C. Next is question number 8. 60-year-old lady present with recent onset of increase in long standing swelling in front of the neck, and the swelling was small and had been present since 30 years. Okay, but has now increased to more than twice the size in last 2 months. Okay, on examination the swelling is firm and hard in consistency and move with deglutition. Okay, what is the most likely cause in this patient? Okay, so the first thing you get is this swelling is moving with deglutition, so it is related to thyroid gland. Okay, okay, okay. And the swelling is long standing, means this lady has goiter. Okay, and the last 2 months this swelling is hard. Okay, hard. Okay, and increasing swelling. So there is a paragraph, you see, the painful nodule or sudden appears or rapid enlargement of nodule raise suspicion of carcinoma. Okay, there is a hemorrhage can be occur, but they have given the 2 months. If there is last 2 days, then you can take hemorrhage as an option, but it is last 2 months, so it is cancer. Okay, so option C. Next is question number 9. The following chromosomal abnormality are associated with brain tumor. So this question taken from this table. So neurofibromatosis type 1 is associated with astrocytoma, type 2 is associated with acoustic neuroma or meningioma. Okay, then hereditary non-polyposis colorectal cancer is associated with astrocytoma. So Peutz Jeghers is not associated with brain tumor. So option B is answer. Okay, now is question number 10. Which of the following is correct regarding the witch milk? Okay, so this is taken from the 27th edition of Bailey. Okay, so mastitis of infant at last is common in boys and girls, both it is common. Okay, and it is seen on the third and fourth day of life. The key word is it is seen in only in full term infant. Okay, so it is most of the disease occur in the premature, but this is not the disease, this is just the physiological changes. So it is occurring full term infant. Okay, why? Because of drop in maternal estrogen, and which is essentially physiological. Okay, so it is physiological, not pathological, that's why it is full term, and disappear by third week. So appear on third day, disappear by third week. Okay, and full term infants. Okay, this is also called witch milk. Okay, sometime it can be get true mastitis because of staph aureus. So here it is, options are seen in full term infants, it is correct. It is not seen in preterm, so this is wrong. Okay, then it is caused by stimulus of fetal breast vaporization. No, it is drop in maternal estrogen. Okay, so option A is correct answer. Now question number 11. Which of the following statement are correct regarding Barrett esophagus? So this is question taken from the Bailey only. So Barrett, it is a metaplastic changes. Yes, this is metaplasia, risk factor for development of adenocarcinoma. Okay, and ingestion of NSAID is etiological factor for development. No, this is not the correct one. And the endoscopic mucosal resection is a effective treatment. Yes, so endoscopic ablations should only be applied on the flat lesion without nodularity, ulceration, irregular contour. Okay, so EMR or endoscopic mucosal resection, you can treat the Barrett esophagus. So 1, 2 and 4. Next one is question number 12. Which of the following are complication of liver trauma? So this question taken from this table of Bailey, complication of liver trauma. So liver abscess, yes, liver abscess is biliary fistula, yes. Then liver failure, yes. Okay, so portal thrombosis is not a complication of liver trauma. Okay, so option B is correct one. Okay, now question number 13. Which of the following are local complication of acute pancreatitis? So this question taken from this table. Okay, local complication of acute pancreatitis. So this is local complication. Okay, local complication usually occur after the first week. Systemic complication occur the first week. So in acute pancreatitis, systemic feature appear first, then the local feature. Okay, okay. So pseudocyst, yes, this is the local feature. Next is pleural effusion. Yes, pleural effusion is a local feature. Then acute fluid collection. Okay, this is peripancreatic fluid collection. Ileus is a systemic feature. Okay, so ileus is not the answer. not seen in as a local complication. So options 1, 2 and 4. Option C is correct one. Next is 14. Okay, which of the following are the risk factor for development of pancreatic cancer? Okay, so this is taken from this table of Bailey. So risk factor for development of the pancreatic cancer: the male, black ethnicity, cigarette smoking. Okay, so cigarette smoking, yes. Diabetes mellitus, yes, diabetes. Then Caucasian ethnicity, no, it is black ethnicity, and male gender, yes. So options are 1, 2 and 4. Okay, so C is the correct one. Next is which of the following are metabolic causes of splenic enlargement? So this is also taken from the Bailey. Metabolic enlargement of spleen is rickets, amyloid, porphyria and Gaucher. Okay, so amyloid and, like, the first is given is rickets but not the still. Then porphyria and felty, no, felty is not related to metabolic. So amyloid and Gaucher disease, amyloid, this one and this one, they have taken these two options. Okay, so option B is correct one. Next is question number 16. Which of the following statement is correct about mesenteric cyst? So directly taken from this table of Bailey. So mesenteric cyst clinical feature: adult with mean age of 45. Okay, 45. So it is commonly seen in children less than 18 years of age. Wrong. Okay, more common in males. No, this is twice common in women. This is also wrong. Presently mostly as a painless abdominal swelling. Yes, this is present as painless abdominal swelling. Most common presentation is painless fluctuant abdominal swelling near the umbilicus. Okay, and the percutaneous aspiration with injection of sclerosant is the preferred. No, it's excision. Okay, anywhere in the cyst you have to excise. Okay, but further detail you need to know, like two type of cyst. Okay, so next is 17. Which of the following are the feature of the umbilical hernia in adults? So there is one topic, umbilical hernia in adult. Okay, so it is because of the thinning and stretching of the midline raphe or linea alba. So the first option is, they have given, patient commonly overweight with thin and attenuated midline raphe. So this line, this they have taken this line, overweight man with thin and attenuated midline raphe. Okay, most patient complain of pain due to tissue tension. Okay, yes, pain due to tissue tension or symptom of intermittent bowel obstruction. Okay, so this is also correct. Men are affected more commonly than women. No, women are affected more commonly than men. Yes. Okay, so this is wrong. And hernia repair can be done by technique of described by Mayo. Yes, so this is called waistcoat over the trouser or Mayo. Okay, this is also famous question. Okay, so option B is correct one. Okay, next is question number 18. Which of the following common causes of perforation of esophagus? So this is very good question. You may get confused with iatrogenic infection. They have written the iatrogenic infection. Look what the Bailey given. Bailey given iatrogenic perforation, not infection. Okay, so iatrogenic perforation secondary to endoscopic procedure is more common cause. But if this is not in the option, so you can go with barotrauma, because spontaneous emetogenic perforation, that is Borhave, result from the sudden increase in esophageal pressure, because that's why it's called barotrauma against the closed glottis from the vomiters. So this is, you can take as a second option, but since this iatrogenic perforation is not given, you can go with the barotrauma. Okay, that's what UPSC also given. Okay, now question number 19, very famous question, you must know this topic, stage of damage control surgery. Okay, so what are the stage of damage control surgery? The first, you have to select the patient. Okay, next is control of hemorrhage. Okay, and then third is resuscitation in ICU, and the fourth is definitive surgery. It is written preventive surgery, no, it is definitive surgery. Okay, and fifth is abdominal closure. Okay, you look again, the first is patient selection. It starts from stages of damage control surgery. So stage is selection, off is of the hemorrhage and of the contamination too. Okay, then third is ICU. The third one is third letter ICU. Fourth is definitive. So D is 4. They mostly ask one liner which is what are the stage of definitive surgery. So D is fourth. And the last one is abdominal closure. Okay. So next is regarding RCC. So which of the following statement are correct regarding renal cell carcinoma? Okay. So it is arise from epithelium of proximal convoluted tubule. So RCC is adenocarcinoma arising from the proximal renal tubular epithelium. So this is true. It is a female predisposition. No. This is most common solid neoplasm of the kidney and around 2 to 5% of the cancer in adult man. So man is more common. 1 to 3 is female. So it is more common in male than female. So this is wrong. Major subtype of clear cell, papillary and chromophobe. Yes, these are the type: clear cell, papillary, chromophobe. Okay. And surgery is mainstay of the treatment of organ confined the disease. Okay. So this is also direct line. So radical nephrectomy remains the gold standard treatment for localized disease. Okay. So option C is the answer. Now is question number 21. Which of the following are the feature of autosomal dominant polycystic kidney disease? So autosomal polycystic kidney disease. So direct line from this table. This is autosomal dominant, name itself written. So also the cyst also occur in the liver, pancreas and arachnoid membrane. So these are the cyst may also occur in liver, pancreas and arachnoid membrane. Okay. The most common manifestation between age of 20 to 30. So it does not manifest before age of 30 years. So this is wrong. The clinical manifestation are renal and extra-renal. Yes, there is a renal and extra. Clinical manifestation divided into renal and extra-renal. Okay. And men tend to progress to renal failure more rapidly than women. Men tends to progress renal failure more rapidly than women. Okay. So this is also correct. Okay. So option C is correct answer. So now is ESWL is most commonly used for treatment of unit tract stone. Okay. So ESWL most commonly used in treatment of renal stone. Okay. And there is a complication of this treatment is strain stress. So street of stone. So this is also very famous question. 23. Consider the following clinical feature. Okay, rage, ICP, seizure, focal deficit and headache. So which are the clinical feature of related to most brain tumor? So there is a triad of brain tumor symptom. Okay, so rage, ICP, seizure and focal deficit. But rage ICP, the headache is presenting feature only in 50% of the rage ICP. Okay, so that's why option will be A. Okay, so 1, 2, 3, 4 all are the correct answer. Okay. So next is most common type of brain tumor associated with neurofibromatosis. Type 1 brain tumor syndrome is astrocytoma. You can see the type 1 is related to astrocytoma. So 1 is A. Okay, remember like that. Next is which of the following is correct regarding herniation via foramen of Morgagni. Okay, it occur posteriorly in the chest. So look what is given in belly, foramen of Morgagni, anterior part of the diaphragm. So it is not posteriorly, so anterior. Transverse colon is commonest content. Yes, the most commonly involved viscera is transverse colon. Okay, so this is correct. Defect between sternum and costal attachment. So written defect between the sternal and costal attachment. So this is also true. It is a type of congenital hernia. Yes, the congenital site where abdominal viscera can herniate into chest is foramen of Morgagni and foramen of Bochdelic. So this is also true. So option D is correct answer. The next is 26. Okay. So 40-year-old lady complained of progressive deformity of her hand and finger associated with stiffness which is present in both hand and improved day progress. On examination there is a symmetrical involvement of hand and finger, both upper limb and flexion and ulnar deviation of the metacarpophalangeal joint. What is the most likely diagnosis? So many hints regarding the rheumatoid arthritis. Okay. So classical symptom is morning stiffness. Okay. And then there is a radial drift on the wrist and ulnar deviation. Okay. And there is one more I wanted to point out, Wagon Jackson syndrome associated with rheumatoid arthritis. Okay. So option C is answer. Next is 27. 52-year-old female complained of increasing pain in the right shoulder. She is also find it increasingly difficult to do overhead abduction of the affected joint. She had since diagnosed a diabetic 20 years back and is on treatment since then. What is the most likely cause of clinical condition? So it's frozen shoulder, also known as adhesive capsulitis. It is occur in female. Your patient is also female. Okay, in 50s. Yes, 52-year-old. Okay, and there is a reduce in glenohumeral motion. Okay, that's why it is difficult to do overhead abduction. Okay, and seen in diabetics. See, considerably longer in individual with diabetics. Okay, so it is frozen shoulder. Okay, option B. Next is 28. 20-year-old female present with OPD with complaint of progressively increased swelling in the dorsum of the left wrist, and swelling is cystic and non-tender. On examination become more prominent on plantar flexion of the wrist. The swelling is 2 cross 1 centimeter in size. What is likely diagnosis? So it is classical feature of ganglion cyst. Okay, ganglion cyst. Why ganglion cyst? Okay, so it is a commonest swelling in the hand, most often on the dorsum. So dorsal. Okay, dorsal. Okay, smooth, fluctuant, and transilluminate. Okay, it is cystic, non-tender. Okay, and more prominent on plantar flexion. Okay, and treatment is surgical excision. Okay. Next is upper motor neuron lesion are characterized by which of the following? Okay, so this table, this question from this table, upper motor neuron lesion are characterized by increased tone, hyperreflexia, muscle spasm, motor weakness, diffuse atrophy, positive Hoffman sign, ankle plantar clonus, and ongoing plantar response. So let's see what they have. Increased tone of spasticity, yes, increased tone and spasticity. Hyperreflexia, yes, hyperreflexia. Absent plantar response, okay. So it is not absent plantar response. Okay. And motor weakness, yes, motor weakness, okay. So it's muscle spasm, not absent plantar response, okay. So option B is answer. Okay. Next is 30. Question number 30. So 56-year female has been diagnosed with gallstone undergoing pre-anesthesia checkup. She has been diabetic since 15 years, but sugar is level is within normal limit. So this is comes under which physical status? Okay. So this is ASA2 because mild systemic disease, no functional limitation. Okay. Okay. I have made video on this. You can watch. Okay. So question number 31. So 30-year-old RTA victim is being taken up for emergency laparotomy for hemoperitoneum and suspecting multi-organ trauma. Which of the following will be indication for performing damage control surgery? So BP, so BP is less than 100. So BP, this is also very famous question. You must know this topic while going any examination. So damage control surgery criteria, DCS. Okay, so BP should be less than 70. Okay, then acidosis is less than 7.2. Okay, not 7.3. Okay, and hypothermia is 36. No, hypothermia is 34. Okay, coagulopathy, yes, coagulopathy answer. Okay, so this is also from belly only. Now 32. Consider the following: pain relief, prevention of infection, anesthesia, and restoration of anatomy. Which of the following given above the benefits of fracture treatment? Okay, so this is also from table of Bailey. Risk and benefit of fracture treatment. Benefits are pain relief, yes, prevention of infection, yes, then restoration of anatomy. Okay, and the anesthesia is a risk of fracture treatment. Okay, so option C. 33. A 30-year-old motorbike rider brought to emergency with history of RTA and alter conscious. On secondary survey, the doctor noticed presence of bruise over the left mastoid process. The finding indicate, okay. So this question taken from this picture of Bailey, very famous picture. So this is known as a Battle sign. Okay, Battle sign. It is a seen in skull base fracture and bruise seen over mastoid process. Okay. Hangman fracture. So hangman fracture is fracture of C2. Two name hangman. So it's C2. Remember that. And this is also picture given in Bailey. So this is C1. This is C2, and you can see the fracture. Okay. So traumatic spondylolisthesis of axial vertebra C2. Okay. This direct line from Bailey. Which of the following is correct in response to SRIAS? Okay. So the first they have given the option caused by release of lipopolysaccharide, a endotoxin from dying of E. coli bacteria. Look, SRI is thought to be release of lipopolysaccharide endotoxin released from wall of dying gram-negative bacilli, mainly E. coli. So this is true. It is same as bacteremia. SARS should not be confused with bacteremia. Okay, but two may coexist. So this is not same as bacteremia. It is result in MODS, multi-organ dysfunction. Yes, this can result in multi-organ dysfunction. Okay, and the last is white cell counts is more than 12. Okay, so yes, white cell count is more than 12. Okay, okay, so option C is answer. A surgeon is about to start laparoscopic procedure on patient, and floor nurse is asked the surgeon about identity of the patient, site, procedure, and the performance. Any anticipated critical event during the surgery. These questions are part of. So this is part of WHO surgical safety checklist. Okay. So you see the will nurse, anesthesia, and surgeon confirm the team member. Okay. So confirm the name, procedure, any incision, where the incision will be made. Okay, any critical events. Okay, so this is the part of WHO surgical safety checklist. Okay, so next is 37. Which are the following correct for managing the hypertrophic scar? So you see this question is taken from this table of Bailey. So you can use silicone gel sheet. Okay, silicone gel sheet. Then incisional steroid. Yes, you can give the steroid. Okay, yeah, intralesional steroid. Okay, Kenacort we give, and then laser treatment. Yes, you can also go for laser treatment, but you cannot, there is no vitamin A gel application in hypertrophic scar. Okay, now is which of the following approximate daily requirement common electrolyte in adult? Okay, so this question taken from the 27th edition of Bailey. So you can see the sodium is 50 to 90. Okay, yes, 50 to 90. Calcium is 1. No, calcium is 5. Okay, calcium is 5. Remember. Okay, then potassium is 50. Yes, potassium is 50, and magnesium is 1. Okay, but this is modified in 28th edition. Okay, this is 28. This is 27th. Okay, so in 28 the sodium has the in per kg. Okay, there was this all are in days. Okay, do not confuse, but this is per kg sodium and potassium. So potassium per kg 1 millimole, but when you take at the day it is 50. Okay, so sodium 0.9 to 1.2 millimole per kg per day. Okay, okay, next is 39. Distributive shock is described by which of the following patient of cardiovascular response? Okay, so distributive shock in Bailey they have given it is seen mainly in septic shock, anaphylaxis, or spinal cord injury. Okay, so there is a vascular dilatation. Yes, then with low systemic vascular resistance. Yes, reduced peripheral vascular resistance, and there is a inadequate afterload. Yes, and low cardiac output. No, this is high cardiac output. Okay, so option D is answer. Next is last one is question number 40. The best measure of organ perfusion and best monitor adequacy of the shock therapy. This is very famous question, multiple time asked, and teachers mainly confuse with different fancy word. You just remember the direct line from Bailey. The best measure of organ perfusion and best monitor of adequacy of shock therapy is urine output. Okay, do not confuse. Okay, so urine output is answer. Okay, thank you. I hope this will helpful. If you like this video, you can like and you can post. I can make 2023 CMS a surgery question explanation also. Okay, with proper authentic reference. Thank you.